welcome back to pregnancy series. In today's video we are going to talk about ovarian cyst. Now, if you have not subscribed, please kindly do so. If you have not turned your notification bell, kindly do so. Comment, like and share the content because we have a very good content. So what is ovarian cyst? Ovarian cysts are common growth that develop on or inside your ovary. There are several types of the cyst. The most common kind are harmless, don't cause any symptoms and eventually go away without treatment. Rarely do ovarian cysts require medical attention. So maybe let me say that getting regular pelvic exam can help reduce your chances for experiencing a problem with the cyst. But most of the time, if you don't do pelvic exam, maybe you might not know that you are having ovarian cyst. So let us define it. An ovarian cyst is a sac filled with fluid or semi-solid materials that forms on or within one or both within one or both ovaries. Now, your ovaries are small organ in your pelvic that hold egg cells and make hormones such as estrogen and progesterone. So there are different types of ovarian cysts, most of which are painless and harmless. And usually, ovarian cysts don't cause any symptoms. You likely won't know you have an ovarian cyst unless the pelvic exam has been done. So we have different types of ovarian cysts and we are going to look at those types, and I'm going to define them in details. So most ovarian cysts are functional cysts. Most ovarian cysts are functional cysts. They form in response of the body changes during your menstrual cycle. Less commonly, ovarian cysts form for reasons unrelated to menstruation. Less commonly, ovarian cysts form for the reason unrelated to menstruation or menstrual cycle. So let's define functional cyst, or let us look at what it is, functional cyst, because it is the most common one, and most of the time it start growing in response to changes that take place during your menstrual cycle. So functional cysts are the most common type. I've said that are the most common types of ovarian cysts and are not disease related. They occur as a result of ovulation. In this cyst can be a sign that your ovaries are functioning as they should be. That is a good thing about it. Can be a sign that your ovaries are functioning as they should do. So functional cysts generally shrink over time, usually within 60 days without specific treatment. I think in during your reproductive age, there are times that you will experience these cysts and they will shrink without you even noticing. So that is functional cyst. Most of the time they form during ovulation, and then they shrink by their own without any treatment, and even they don't produce any signs and symptoms. So the second type, we have follicular cyst. Follicular cyst is a small sac in your ovary called a follicle, and releases an egg each month as part of the menstrual cycle. A follicular cyst forms when the follicle doesn't release an egg. Instead, the follicles filled with fluid. Now, the third type is corpus luteum cyst. Corpus luteum cyst. Now, after the follicle releases an egg, it forms an hormone producing a group of cells called the corpus luteum. Now, a cyst forms when fluid collects in the corpus luteum, causing it to grow. Now, that is the follicular cyst. Now, let's look at other cysts that can make you worry about yourself. So I was saying other cysts. Let's look at other cysts. Not all ovarian cysts form in response of your menstrual cycle. The one that form in response to your menstrual cycle is functional follicle and luteum or luteal. So we have other cysts that do not form in response of your menstrual cycle, but they are related to reproductive health or reproductive system. So they are not always signs of a disease, and a cyst is not always a sign of a disease. So they are not always signs of disease, but your provider may want to monitor them to ensure that they don't cause any complication. So, and this cysts include cystadenomas, yeah. This one is number one, cystadenomas. We have dermoid cyst, yeah, we have dermoid cyst. We have endometriomas cyst, and we have ovarian cancer, where this one is now. So let us look at cystadenomas cyst. These cysts form on the surface of the ovary now, and they can be filled with fluid that is thin and watery or thicker or mucus. What have I said? I said that they form on the surface of the ovary and they can be filled with fluid or watery or thick mucus. The next one, we have dermoid cyst. Dermoid cysts consist of cells that make up all types of tissues, and in the human body, type of cell of cyst. Dermoid cyst consists of cells that make up all types of tissues in human body, ranging from skin, hair, teeth, and even brain tissues. The next one, we have endometrioma cysts. These cysts are filled with endometrial tissues, the same tissue that will bleed each month during your menstrual period. Yeah. The next one, we have ovarian cancer. Unlike the condition above, ovarian cancer or tumor or cyst are solid masses of cancer cells. Yeah. The next question that you should ask yourself is, who is affected by ovarian cyst, or who is at risk of getting ovarian cyst? Any woman of reproductive age can get ovarian cyst, but also we have other factors that can put you at risk of getting ovarian cyst. So anyone with ovary or any woman who is in a reproductive age can develop an ovarian cyst. So the other things that can put you at higher risk of getting ovarian cyst is age. Ovarian cysts are more commonly if you haven't gone through menopause. So that is why I said before, if you are within reproductive age, you are at risk of getting ovarian cyst. The next one is pregnancy status. Cysts are more likely to form and remain during pregnancy. So you might get pregnant and you don't know that you are having cyst. And when you go for vaginal delivery, maybe your healthcare provider won't do pelvic exam or do ultrasound to find out if you are having a cyst, because maybe sometimes they don't produce any symptoms and it is hard to identify. So pregnancy stage can put you at risk of getting ovarian cyst. The next one is history of ovarian cyst. If you have ever suffered from an ovarian cyst, you are likely to get an ovarian cyst in future. So this one is also another risk factor. and also family history can also put you at risk of getting ovarian cyst. Current condition, like you are more likely to get an ovarian cyst if you have endometriosis, hormone problem, or if you are taking medication to help you with ovulation, you are likely to get ovarian cyst. Another question that you're asking yourself, and I'm here to answer you: how common are ovarian cysts? Ovarian cysts are extremely common, especially if you haven't gone through menopause. You are at risk of getting ovarian cysts, especially functional cyst. Functional cyst is also known as simple cyst. You are at risk of getting this functional cyst if you haven't gone through menopause, or if you are still in reproductive age. Now, somebody I know is asking herself or himself, are ovarian cysts how do you say, are ovarian cysts, how serious are ovarian cysts? I can say usually most ovarian cysts are harmless, and they often go on their own way. They just disappear by themselves. Some types of cysts are more likely to become cancerous or cause a complication, but this is rare, maybe 1% out of those cysts that I've mentioned. And your provider, if they identify you have other cysts that I said, the dermoid cyst, the other cyst that I said, your provider might monitor this cyst to know maybe the cause, and to see if they can turn or they can bring other complications. So it is not more serious, but some of them might turn into cancerous. Now, another question that we are going to answer in this video is: what causes an ovarian cyst? Ovulation is the most leading cause of ovarian cyst. Other causes may include abnormal cell production, a typical cell production that can cause cysts like dermoid and adenomas to form. Those are abnormal cell production. So abnormal cell production can also cause ovarian cyst. Endometriosis, these cysts often form on the ovary in the advanced stage of endometriosis. Another cause is also pelvic inflammatory disease, PID, what we usually call PID. Severe pelvic inflammation can spread to your ovary and cause the cyst. So we have said we have ovulation, number one. We have abnormal cell production, endometriosis, and PID. Those are the causes of cyst. Let's just look at the signs and symptoms of cyst. Some smaller cysts cause no symptoms. In this case, you may not even know that you have a cyst. A large cyst may cause pelvic pain or a dull ankle pain, or a dull pain at the back. Also, you can have a feeling of fullness or bloating located in your lower belly that may feel more pronounced on the other side of your body. Also, pain during intercourse is also another thing that you might experience, or dyspareunia. Pain during intercourse or dyspareunia, painful menstrual period, is also another sign that might come in. Symptoms that linger could indicate a condition called polycystic ovary. What did I say? Symptoms that linger could indicate a condition that is called polycystic ovary syndrome. Now, this is a condition that causes irregular periods and other hormones related problems, including obesity and infertility. Other symptoms of the polycystic ovary syndrome include increased growth of body hair and difficulty in losing weight. So if you're obese, go and check, you might be having this condition. So what does it feel like when somebody have a cyst on the ovary? The experience of having an ovarian cyst vary from person to person. I can't say that exact feeling, but sometimes there is no pain at all to people. To some people, other people, you might feel those pains that I've described. Some mild discomfort or feeling of fullness, pain that could be described as sharp or like a dull ache, also discomfort during sexual intercourse and menstrual period. Let's talk about prevention of ovarian cyst. So maybe if the doctor realizes you're having a cyst, the doctor can prescribe for you hormonal medications, and you take these hormones so that you stop ovulating for some times, and then the cyst will shrink. Because most of the cysts are usually harmless, it will shrink and it will goes by its own. That's maybe the prevention that can take place. I think I've reached the end of this video. So if you have not subscribed, please kindly do. Please subscribe, because you are watching my content. Imagine 70% people, 70 plus, not even 70%, 70 plus people are watching this content without subscribing. It's not good. So please kindly subscribe, like my video, share, comment, and let's meet in the next video. Bye. So what are some of the complications that can set in when you have an ovarian cyst? We have cancerous cyst. Ovarian cysts that developed after menopause are more likely to be cancerous than cysts that form before menopause. So if you're having a cyst after menopause, you're likely to have ovarian cancer. Also, we have rupture of ovarian cyst. Functional cyst commonly rupture without causing any negative symptoms. So this cyst can rupture and it doesn't cause any symptoms. But sometimes a rupture cyst can cause severe pain and swelling in the belly. Now, the larger it is, the greater likelihood it has of breaking. We also have ovarian torsion. The ovary can twist. It can twist. An ovary is something like this. Let's assume that this one is the pelvic tube. No, the fallopian tube. This one is the fallopian tube, and this one is the ovary. Now, the ovary holds an ovum. Now, during ovulation, the ovary tends to swell. When it swells, now, when maybe you are moving, you are doing your daily activities, it can twist. It can twist like this. Okay, I'm just making jokes, but it can twist. It can twist like this. It can twist several times, and this can cause pain. This can cut blood supply to the ovary, and then you might have a surgery to remove that ovarian, the ovary. We also have maybe acute pain that can be treated if it is not severe. Those are some of the complications that can set in when you have an ovarian cyst. So ovarian cyst is diagnosed through pelvic exam and ultrasound, among other imaging. So the doctor can decide which imaging she or he will send you for, and then the doctor will get the right information and the type of cyst you are having. So the next thing that we might talk about is about the prevention. Maybe if you're asking if ovarian cyst can be prevented, what is this? if ovarian cyst can be prevented, taking medication that contain hormone will stop ovulation. If you are having ovarian cyst, your doctor can recommend you for an